Starting our newscast tonight with more facts about the coronavirus pandemic and the impact it has on Washington state. So here are the latest numbers. They were just released today. So far, 1,793 people have tested positive for the virus. The majority of those cases are in King and Snohomish counties, and there have been 94 deaths. It is important to note here that more than 25,000 people have tested negative for the virus. That is 93% of those given the test. Well, tonight, healthcare officials around the region are preparing for the most grim public health policies ever considered in Washington state. With a surge in coronavirus cases expected over the next few weeks, the state is now writing up plans for the worst case scenario. Who would have to be turned away from medical care if we do not get massive amounts of new resources soon? As King 5's Susanna Frame reports, preparations have already begun by postponing even surgeries for cancer.
As the days go on, you're still sitting with cancer in your body. And so I just have continued to get more and more scared.
Colleen McMahon Grace of West Seattle was a healthy 49-year-old. She thought she was until 3 weeks ago when she was diagnosed with colon cancer. Her doctors at Swedish scheduled a surgery to remove the cancerous mass. But then, just days before, they called with startling news. The surgery had to be postponed to make room for patients with the coronavirus.
My biggest concern is that if I don't get the surgery, that the cancer will progress and my outcome will be different. That's my biggest concern right now.
Canceling surgeries for what are most likely slow-growing cancers is just one step our medical community is taking to get ready for a major spike in COVID-19 cases. Health officials are pleading with the federal government to get more resources here fast, such as the Navy ship Mercy. That would come complete with supplies, staff, and beds for up to 1,000 patients.
I think the war analogy is a good one. This is a war against this disease. As if we were going to war, we need to get our resources going, get the manufacturing going, get the field hospitals set up, really treat it as if it's a war and we're trying to protect our citizens the best we can.
Cassie Sauer, director of the state's hospital association, is one of the public health experts organizing the plan on how to proceed if we hit a critical shortage of resources. That includes formulating a policy on deciding who gets treatment and who would be turned away. Literally, life and death decisions would have to be made, officials say, if the feds don't bring in more beds, ventilators, and medical providers.
I do feel like there's a sense of frustration on your part.
There is, absolutely. The notion that in America in 2020 we could get to a place where we would be denying people care who have a chance of survival, I believe is fundamentally immoral, and we need to move fast to make sure it doesn't happen.
Cancer patients are pleading for help too.
I'm really scared for people, and it's such a lonely feeling, and it's so hard to have something going on with your body, and the people we turn to normally can't answer the questions either, and that's really scary. It's hard to not feel very alone.
Cassie Sauer of the Hospital Association says citizens can help by getting in touch with their federal representatives and letting them know this is serious and we need help now. Susanna Frame, King 5 News.
Well, there are more than 20,000 COVID-19 cases across the nation. More than 80 million Americans have now been ordered to stay home to help slow the spread of the virus. So far, 5 states have now told people to stay home. That's New York, California, Connecticut, Illinois, and New Jersey. Los Angeles emergency response officials say the power to beat COVID-19 lies with every single American.
The only tool you have right now to fight this virus is people voluntarily staying home.
It's the only thing at the table. If the majority of our population heed this warning, then we will be ahead of the game. I truly believe so.
Grocery stores, gas stations, and pharmacies are among the essential businesses which are staying open in those 5 states. Well, today, Everett joins the list of cities issuing a directive for residents to just stay home. King 5's Kayla Lafferty spoke with Mayor Cassie Franklin about what this means exactly for the people of Everett.
Closed signs are up on businesses and sidewalks are empty in downtown Everett after Mayor Cassie Franklin decided that people need to stay home.
I had to act in this way to protect my local community, what I'm seeing in our city, and I feel that this was the right time to issue this directive.
This does not include jobs considered essential, like doctors, nurses, even childcare workers.
Somebody asked me about childcare. Why do we have kids still gathering? Well, nurses and doctors need some place to bring their children so that they can go to work and take care of those that are sick.
Businesses are also asked to close, except for places like pharmacies, grocery stores, banks, and more.
If we have a business that is developing ventilators, we want to make sure that they stay operational. And obviously we don't want to interrupt the food supply chain, so we need those businesses to stay operational.
This decision is one of the first in our state. So Governor Inslee hasn't even done anything like this in the state. So why Everett? Why are you putting this in place here in Everett?
I was driving home from my office at around 5, and it was still rush hour traffic, and I felt the need to communicate more boldly with our residents the urgency of this matter, that we need to act quickly now to save lives in our community.
Under the directive, you can still go to the store or even out on walks, runs, or hikes as long as you're following social distancing guidelines.
I know this is a stressful time. It's okay to go outside and take a walk, but really it is so important that you stay within your household unit and reduce the spread. Even if you don't have any symptoms, you can be a carrier.
In Everett, Kayla Lafferty, King 5 News.
And an example of why social distancing is so important right now. So tonight, Skagit County public health officials are investigating a cluster of COVID-19 cases that are linked to one single meeting that involved 56 people on March 10th. Now, since that meeting, 11 people have confirmed cases of COVID-19, and then another 32 have what appears to be COVID-19. So that is 43 people out of that 56 who met. This afternoon, I talked to Dr. Howard Librand, who stressed the importance of social distancing.
The number of people who contracted the illness apparently through this single episode, it's pretty astounding, and certainly just reiterates the importance for physical distancing, not meeting in groups, not going within that 6-foot range of other people.
Again, out of the 56 people who met during that one time, 43 either have a confirmed COVID-19 case or they're showing symptoms. And Dr. Librand also says that at the time that meeting happened, no one had been ill. Well, tonight, we are hearing from a woman who has COVID-19, and she says she likely got it while performing at a show just 3 weeks ago. At the same time, one of her daughters was rushed to the hospital, and she has not been able to go see her. Our Tony Black spoke with her about her experience and what she is calling on others to do right now.
It's one of the most difficult things a parent could hear.
She's a 41-year-old healthy girl who wouldn't wake up from a nap, and she was discovered that she couldn't wake up and had a brain bleed from a tumor.
Susan Mango's daughter, Lauren, was rushed to the hospital on March 10th.
My family is hysterical.
Susan says while everything was happening, she stayed home with her granddaughter because she didn't feel right.
That whole first day, I kept thinking in the middle of this unbelievable shock, I'm thinking, am I feeling like I'm sick?
Susan says she had a fever, but no other symptoms related to the coronavirus. She knew the dangers and isolated, and the hospital would not let her visit her daughter because of her symptoms.
For 10 days, I'm telling everybody there's no way I've got anything because I only have fever.
Susan eventually did get tested for coronavirus and got her results back on Friday, and they were positive. Susan says she has an idea of where she may have caught it.
I'm in a band. Saturday, March 7th, we were at McMiniman's, my band, and have a great time. The 9th, 2 days later, we're all at rehearsal. Everyone feels fine, but we're all together. The very next day, I learned later, everyone came down with fever.
She says her and another bandmate have tested positive, but is unsure of the others.
I want to really get the message out there that if anybody is tested positive, you have a big responsibility to talk to anyone you've been in touch with.
Her biggest concern now is for her family, who came in close contact with her before she showed symptoms, and her daughter, who remains in the hospital.
Thank God I isolated. Thank God the hospital did not allow me to go in there, because at first I was furious. Come on, my daughter, my baby is in the middle of the worst thing of her life.
Tony Black, King 5 News.
Well, Susan says her husband, who was originally helping her around the house when she was isolating, is now showing symptoms, as is her other daughter. Now, as for Lauren, the one in the hospital, they're still waiting to hear back about her diagnosis. Susan says she is not sure if they tested Lauren for the coronavirus. Well, Target says it is donating N95 masks, which were accidentally sent to the stores for purchase. So Daniel D. posted this picture online showing masks on the shelf at the Bonnie Lake Target. So Target apologized for this and sent a statement to King 5 that it has quickly removed the masks from stores and are donating them to the State Department of Health for distribution to local hospitals. Doctors and nurses around the nation have been sounding the alarm about a shortage of supplies in the fight against this virus. Private companies such as Hanes and Pernod Ricard announced that they'll be producing critical supplies like masks and hand sanitizers. The Washington Post reports dozens of medical workers have tested positive for COVID-19. Volunteers, they're now sewing masks in Western Washington. And at New York Presbyterian, the staff received a letter saying there's only enough supply to give everyone in the organization one mask. The University of Nebraska Medical Center is extending the supply by disinfecting supplies with UV lights.
Normal times, these N95 respirators are used once and then discarded, and we just don't have that luxury right now. So these will allow us to use them 2 or 3 times, and we're conducting assessments to see if we can actually reuse them more times than that.
Another thing in high demand, ventilators. And the supply of ventilators might fall far short of what's needed. Today, King County said it will work with Harborview Medical Center to open up a brand new isolation and recovery center. So that will be in this building, Harborview Hall on 9th Avenue in Seattle. The space can hold up to 45 people recovering from the virus.